Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm talking to Dr. Won Chung. He's an emergency medicine physician, and he's also the co-founder and chief medical officer of Carrot Health. Won, thanks for joining me today on the show.
Of course. Thank you very much, Nick. I appreciate you having me here today. Glad to be here.
So, first of all, tell us a little bit about Carrot Health. Unusual name. What is Carrot Health and what do they do?
Yes. So Carrot Health really, in a sentence, is we predict healthcare outcomes from everyday behavior. So here's a fact. Only about 30% of healthcare outcomes are resultant secondary to clinical determinants, right? So whether or not did you pick the right doctor, or did you take the right medicine, or did your physician do the right procedures for you? 70% of healthcare outcomes are really due to what we call everyday behavior or social behavioral determinants. So those things are the things that we live in, such as, well, where do you live? What type of food do you eat? What are your hobbies? Do you have a pet? And how's your social life? And do you smoke? Those kind of things that, make up just your everyday life. And that's the majority of reasons why you have bad healthcare outcomes versus good healthcare outcomes. So what we do is, using big data, we predict the outcomes from that.
So I imagine, as an emergency room physician, that you've seen some of this from a personal standpoint through your practice. I'm curious what the sort of journey was and how you arrived at the concept and, what it was that took you to this point in your journey.
Sure. So I've been practicing emergency medicine now over 20 years, and call it mid-career sort of reflection or sort of resetting. But about halfway mark, I began to realize that majority of my medicine or the practice was really treating the end results of these chronic illnesses, such as diabetes, hypertension. Of course, they show up as, let's say, diabetic foot infections or hypertension-related strokes, coronary artery disease, which takes not just a year or two, but it takes a lifetime. And really the accidental or the sort of happenstance type of medicine was few and far between. And you try to go into what is the causal relationship, or how do we get here as a society or as medicine or medical field. And that's when I started realizing that it really is not necessarily what we do in the medicine field or medical field, but really what do we do as a society and every day that's causing all these poor outcomes.
So I think that's fascinating that, despite being in emergency medicine, delivering all this fantastic care, it turns out, I think based on what you just said, it's 20% are really the accidents or the emergencies. That's the term for the department in other countries. And yet all the others, not so much?
Yeah, exactly. And that's, of course, at the end of that chronic illness, certainly those are emergencies. But people didn't get there just overnight or within a few months or even a few years. It's over the course of a lifetime that something has gone wrong for them, and ultimately they end up in our emergency departments. But wow, it's like, could we have done something way earlier? Could they have done something way earlier that really would have changed a lot of roads? And I recognize that primary care physicians and all the specialists, that's their main sort of goal. But I think what was missing in my mind is a recognition that it's the everyday behavior, such as social and behavioral determinants, that's really causing the poor outcomes.
So how did you get to the point of the big data? What was the connection for you to see that as an opportunity to bring that in? Because it's not something that we naturally see as physicians. We tend to work in the sort of microcosm of our specialty or even the patient sometimes.
Yeah, absolutely. So life is a journey. My life certainly has been one. And here's so after recognizing that, and I was a clinical director at the time, I realized that a business school with all its focus on operations, as well as, and remember back then this was just a sort of thought I had and sort of frustration, if you will, about medicine. And what I was really hoping to do is like, well, how can we improve it? And business school is a great place to learn about operations. So which, in the business lingo just means like, well, how does either product or service go from A to B? Well, that really is medicine, really, isn't it? And decided to go into business school here at the University of Minnesota, little plug there. And that's where I met the one of our key founders with me. So Kurt Waltenbaugh and I, we went through the business school together, and he comes back from the background of big data and big sort of IT and retail specifically in big data. And he and I were talking one day. I said, if I had credit card information, and we're just talking about health of the people, I said, I could tell you the A1C of my patients even before they step into my office, right? And Nick, you're a physician. So, I mean, that statement right there, of course, everyone is probably nodding their heads. Like, it makes absolute sense. But for him, it was something like, well, I have that data, and that's what we do in retail, and in marketing or sales or even, just product development. And so, you fast forward and here we are. It's just really just a sort of coincidence how we met and started talking about medicine.
So it's interesting. You highlight that story, and I do this discussion with many great guests, and I can tell you that the common thread that I hear repeatedly, and it's the one that I didn't sort of push you towards this, but you essentially came to it, is this incremental improvement. So much of that is about adjacent possible with the right individuals connected and together. And you can consider it chance or however, but essentially to me, the key thread here was the opportunity to spend time with somebody that didn't have the medicine perspective that you have, treating patients, an opportunity to share some of your experiences and to hear about them that provided this insight that has essentially created a company and is now starting to generate some of the new opportunities for information and a way to improve healthcare in a completely different way. Fair comment?
Yes, absolutely. So I love the name Incrementalist because it really denotes what I think we do, again, on an everyday basis, right? So whether it's me talking about health of a consumer on what they do every day, or whether it's about the progress of medicine, really is an incremental, just a very dogged approach that that life takes. And whether or not you believe in that is, I believe this is just what happens, right? Certainly there are revolutionary type of things that can happen, but all those sort of revolutionary, you call it breakthroughs, they started from somewhere, and it was that evolutionary thing that incremental changes that made those things occur and happen. So as we all sort of work on the backs of the giants, so they've started somewhere. So it's a fascinating and fantastic, I think, term. So I agree with you completely.
Excellent. So one of the things that I'd love to hear is some of the early insights, the experiences that you've had. You've obviously, you're now starting to look at this data in a different way. You're assembling it. Tell us a little bit about what's going on in that space and what you've seen.
Sure. Why don't I just concentrate on diabetes or diabetics? just because it's just some fascinating things that are coming out. So right now, about 10% of U.S. population have diabetes. That's just tremendous number, 30 million, individuals. And of course, even greater number are pre-diabetic. But here's the thing. I mean, this is, again, something that is once I say it, it's obvious, but until then, it just becomes, sort of more murky. But not all diabetics are the same, right? So some diabetic patients really try hard to take care of themselves with exercise, diet, as well as taking their medications correctly, while some really just go off the rails. Here's what we found within our data, and this is the fun part. The people who do take care of themselves, here are the things that they have in common. They're world travelers, or they're travelers in general. They own pets. Dogs specifically are correlated with good diabetic outcomes. They tend to vote. They're very civic-minded, and there are myriads of these kind of data elements that we can tell you about people who are diabetic and taking care of themselves. And here's the thing about who are poor sort of outcome who are diabetic. They're almost the opposite, right? They tend to be homebodies. They tend to live alone. So social isolation is a huge factor in who they are, and one of the sort of correlations that's associated with poor outcomes. They also tend to basically not vote, not civic-minded. Zip codes can play a role, but not always. So where you live is a huge factor, but not always. And how close are you to grocery stores or, shopping areas are also critical. So that's what we call food deserts, right? So do you live in a food desert where all you have are fast food places? So those are some of the things that we found about diabetes that's been fascinating.
So that's really interesting. As you looked at those successful individuals, I mean, travel, I think, is one of the great sort of eye openers. It's interesting that there's that association. As you've looked at this data, obviously what you're talking about is correlation, not causation. Have you started to develop some thoughts or insights? Because obviously the exciting step, aside from being able to identify those individuals, so if we could see that, then we can say, gosh, they have a problem, can we place some intervention? But I think, to me, the next opportunity is the causation, and if so, then there's an opportunity to place some intervention early on in that.
Absolutely. And those are the next steps that we're looking at. Just as a kidding or as a joke, we started talking about possibly becoming a pet service and giving a dog to everybody with diabetes. But, that got shot down really quick. But that aside, is what we're trying to do now is we're working with the sort of provider groups and payers to really try to identify, okay, so now we have at an individual level, because that's the data, kind of data that we have. At the individual level, this person have, let's say, social isolation issues, as well as exercise or lack of exercise and a poor diet. What are the things that we can connect that's already present within that sort of environment? So whether it's through the payers or providers, how can we connect them? So social isolation is a big one because there's so much data out there that shows that it does play a big role in outcomes. So are there programs such as even something like a hobby group is very useful for trying to connect people, whether it's exercise or hobbies, as I mentioned, or even a Meals on Wheels. They're not necessarily providing the meal, but they're providing some sort of social contact for people who are really isolated. And those are the things that we are currently that are currently underway with our group. So those are the next steps, and we're really excited for that from a Carrot Health point of view.
Fantastic. So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Won Chung, the co-founder and chief medical officer for Carrot Health. we were just talking about some of the interventions, and one of the things you highlighted was Meals on Wheels. And again, what I hear repeatedly in my discussions with folks is what I term "what's old is new again." And I have very strong memories of doing Meals on Wheels with my mother, who used to do that locally. That was something that we did where we lived at the time in Scotland. And at the time, obviously, I'm thinking it's about the meals, had never thought about the social isolation. And it occurs to me that one of the other aspects to that was the sort of home visit of the physician, which was a core tenet of doctors, I know, in the US, and still to less of a degree, but certainly still exists in the UK. Is there some potential to sort of reintroduce that? That's maybe not a cost-effective method, but maybe that distributed care is a better form, because it as opposed to asking the patient to come to us, we're not just solving the medical problems, we're also solving some of the social issues.
I think, Nick, those are some great insights. And, I never really thought about sort of home visits as being imperative, but I can see how once we've sort of changed that paradigm to have patients come into our office where it's a sterile environment, and it certainly is isolating in a sense that you have a hard time understanding the context of where that person lives. I think that really changed how we practice. So as you mentioned, if I was able to go into someone's home and see, the milieu that they live in, certainly without even asking any questions, whether it's a survey or or a questionnaire, I should be able to understand right away. It's like, oh, this is the kind of environment that you grew up in or that you're currently in. I see that you have no heat. I see that you have, poor food items in your pantry. And immediately you will understand that, okay, the medicine is only going to help you to a certain point, but here's what we really need, and being able to, I think, do that is currently, I agree with you, is missing. And, I think home care visits could really be an exciting way to do something like that.
It's interesting.
I'm here just learning from you, Nick.
There's other companies that I think that are starting to think about that and showing real benefit, and I'm hoping to actually have one of them on the show. So I'm very excited to sort of tie some of this together. One of the things you and I talked about was some of the other insights that you've seen from the data. Obviously, you're looking at a different data set, not the traditional healthcare one, but you're tying it to healthcare.
Absolutely.
A couple of questions around that. So first of all, how do you bring that data? What's the sort of process? What's the insights or the methodology? Because that interoperability is missing in healthcare. You've obviously started to help solve that, so you're able to do it. I feel like the supermarket knows more about me than my healthcare provider sometimes. And any other sort of insights around that data and surprises to you?
Sure. So absolutely, the interoperability is critical, I think, to what we do. And we are a strong proponent of letting the data into the hands of those who are willing to put it together. So, for example, here's really a simple thing that probably would not have been evident in just looking at the clinical data. What we found is that you've heard the old adage, marriage is good for everyone, or it should be, or it's good for health, right? So I've heard that many different places. Here's what we found is that and this is talking about diabetic, is that we track the diabetic patients from 55 as they sort of start getting older, because that's when, as all of us get older, about 55 and is when a lot of us start having diabetes. At age 65, two distinctive groups started separating out. And when I say groups, I'm talking about for healthcare outcomes or healthcare spend in this case. And the high spending group consisted mostly of single diabetic versus the low spending group, a lot of them were married. And hold on to your hats, at 75, and this is really gets interesting. At 75, one group sort of disappears altogether, and that is single diabetic men. They have disappeared from basically our sort of group. And I'm just talking about statistically, right? So there are certainly a few of them around. And I think what's happening is that basically single diabetic men, they just cannot take care of themselves. So I think what's happening is they're just dying. They certainly do not become all of a sudden non-diabetic, but basically they end up just not being there. So that was just a fascinating fact number one. Here's a second part that was sort of fascinating, is that one group that is healthier than every other group is single diabetic women. So they were healthier than even married diabetic women, or certainly than married diabetic men. And I think what's happening there, unfortunately, is that, just like my wife, women tend to take care of the guys. And, once they don't have that responsibility, they tend to do much better. So, of course, you can make a joke like, hey, if you're a diabetic guy, make sure that you stay married. But if you're a gal, make sure you get a divorce. But all joking aside, that's something that we found, that clearly marriage is not for everyone.
So that's a fascinating additional detail. I think what you're doing is sort of teasing out more insights into something that, intuitively we've sort of found over time. And that's the beauty of this big data. As you start to assemble it, it's one of my precepts in all of this, is that the more data we have, the more opportunity for those insights. And I think that's really, it's the fascinating aspect of that, of bringing all of this information in. And, sometimes they're unimaginable. So you were looking at marriage. That's something that we've known about, but you've found new and more relevant insights that will hopefully help us treat and improve things. But then I bet there's other things that, insights that you develop that you go, well, and it may just be a correlation. It might be a causation. Any like that?
Yeah. Here's maybe a final sort of fun story, or it's a fun fact that we found, is that we look at a lot of different sort of variables within our data. So we have 250 million individual data. Among that, we have over 5,000 variables. And one thing that really we looked at, because we're all actually just big fan of cars, is like, hey, do ownership of cars have anything to do with how people's outcome is, or health outcomes? And yes. So number one brand that has shown to be poor outcomes, Oldsmobile, is Oldsmobile. And specifically Cutlass Sierra tend to so owners of that specific make and model tend to have poor outcomes. And then number one car that's associated with good health tend to be, no surprise there, Toyotas and Hondas, minivans, right? So if you're out there driving a minivan, then you can be rest assured you're with a good group of health conscious people, probably.
Yeah, it's truly fascinating, and I know that's going to create a lot of discussion online and into the future. And I, fully recognize correlation versus causation, but I think that's part of what you hope to achieve in the future. So, any parting thoughts?
Yeah, thank you for having me on. I really appreciate it. And I think this is just beginning the work that we're doing, and everyone, within this group, looking at the everyday behavior, the social determinants of health, and how that impact the health, everyday health, or I should say healthcare outcomes. That work is just beginning. We're just happy to be part of it. And then we're just very happy that people are starting to recognize it within the medical field and outside of it. So thank you for having me again.
So thanks very much, Dr. Won Chung, co-founder and CMO of Carrot Health. Thanks for joining me on the show.
You're welcome. Thank you.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, the Incrementalist, or share with me at Dr. Nick 1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.